guys, welcome back to Neuronify. This is day 6 of our FMT series and the topic is cocaine poisoning. Very short topic yet very interesting topic, and we would be, cocaine is not a new term for us, so it is going to be an interesting topic. Without wasting a single second, let's begin cocaine poisoning. Now, what is the source of cocaine? We all know what cocaine is, but we have to also know the source of cocaine. Leaves of Erythroxylum coca. Remember the plant name, Erythroxylum coca. Street names are coke, crack, snow, vivinite lay. There are two forms, cocaine hydrochloride, which is snorting and injection form, and freebase and crack cocaine, which is smoking form. So what are the two forms? Cocaine hydrochloride and freebase. Cocaine hydrochloride is snorting and injection form, and freebase is smoking form. Now, what are the routes of administration? Snorting, smoking, IV injection, and oral. We all know from movies, okay? Now, what are the preparation? Number 1, chewing of leaves, and number 2, coca paste. That is chewing of leaves. So, coca paste on reaction with HCl gives cocaine hydrochloride, and cocaine hydrochloride upon reacting or adding with baking soda gives crack, which is smoked or which is snorted. So cocaine hydrochloride is reacted or added with baking soda to form crack. Then it is added with heroin or morphine to give speedball, and speedball is added with fentanyl to give super speedball. Cocaine hydrochloride is further added with solvent to give freebase, which is smoked, and we know that freebase is second form of cocaine. Crack and freebase are kind of similar thing, but baking soda is added to form crack while solvent is added to form freebase. So crack is smoked or snorted, freebase is smoked. And speedball, remember speedball and super speedball? You add cocaine hydrochloride with heroin and morphine to give speedball, and speedball is added with fentanyl to give super speedball. So as the names are suggesting, speedball and super speedball are the higher stimulant forms of cocaine. So these forms are very stimulant with respect to the normal cocaine. Now, what is the mechanism of action? Mechanism of action is the cocaine blocks dopamine and norepinephrine reuptake, which increases their levels in synaptic cleft and which leads to vasoconstriction via alpha adrenergic system. In simple words, just understand that cocaine stimulates both the receptors, alpha receptors and beta receptors. So what happens? Beta receptors are responsible for increase in heart rate, okay, and alpha receptors are responsible for vasoconstriction. So as cocaine acts on both of these receptors, subsequently the effect is going to be increase in the heart rate and increase in the blood pressure. So mechanism is cocaine also, besides acting on these receptors, cocaine also blocks dopamine and norepinephrine reuptake. So what are dopamine and norepinephrine? We all know that these are neurotransmitters. So if the reuptake of neurotransmitters are inhibited or blocked, then obviously their levels are going to be increased in the synaptic cleft, which is why there would be vasoconstriction as the effect of increase in the neurotransmitters. And secondly, cocaine acts on CNS. It causes euphoria, it causes temporary happiness, but which is after some time it is followed by depression. So these 2 points should be remembered under the mechanism of action. Stimulates both alpha and beta receptors and also increase the levels of neurotransmitters in synaptic cleft. What about the clinical features? Number 1, CNS effects. Cocaine acts as a CNS stimulant, and one more thing, cocaine comes under the category of deliriants. Now you may ask, what are deliriants? Deliriants are nothing but those substances which cause delirium, which act on CNS and which cause hallucinations, agitation, impaired judgment and confusions. So cocaine comes under deliriants. And on CNS, it acts as a CNS stimulant, initially causing excitatory effects like anxiety and agitation, followed by depression. Serious effects: cocaine use can lead to arterial vasoconstriction because cocaine acts on alpha receptors, resulting in tachycardia, hypertension, and potential MI. Cocaine use can also cause stroke, hypothermia, psychosis, hallucinations, altered tactile sensations as if the bugs are walking or crawling under skin, rhabdomyolysis, breakdown of muscles, intestinal ischemia, and blindness. What are the mild effects? Euphoria, increase in energy and heart rate, BP, mydriasis. What are the severe effects? Agitation, seizures, hypothermia, MI, stroke, hallucinations. And I told you tactile sensations of bugs crawling under the skin. So these are the clinical features: CNS effects, severe effects, mild effects, and severe effects. Now, management of cocaine is very important. You have to remember that basically it is very easy point. Now up till now we just learned that cocaine is a CNS stimulant, and we also learned that cocaine causes agitation and seizures. So let's start with management. Benzodiazepines, lorazepam for agitation and seizures. Very important thing. Before treating a patient, you just have to make that patient stable first, right? To make that patient stable first, you just have to treat the seizures of patient. So why we prescribe benzodiazepines first. Number 2, nitroglycerin or beta blockers for hypertension. Avoid pure beta blockers to prevent the unopposed alpha effect. Now you have to remember that pure beta blockers cause unopposed alpha effect in cocaine poisoning. Now what do I mean by this? I told you earlier that cocaine acts on both receptors, alpha and beta. If you are going to block only beta receptors which are responsible for increase in heart rate, then obviously it is not going to work, because alpha receptors would anyhow cause vasoconstriction. If there is increase in vasoconstriction, obviously there is going to be increase in BP. So to control this condition, you should be prescribing a drug which inhibits both the receptors, alpha also and beta also. So why they said ki do not give pure beta blockers, because these drugs may cause unopposed alpha effect. Unopposed means unaffected. Unopposed alpha effect in simple words is nothing but unaffected alpha receptors. So they're just saying ki you should, obviously alpha receptors are going to be unaffected by beta blockers, pure beta blockers. That is the meaning of this line. Cooling for hypothermia, yes. Activated charcoal for body packers, because activated charcoal absorbs cocaine. Avoid antipsychotics as these decrease the seizure threshold. Now what do we mean? Antipsychotics. Antipsychotics are those drugs which block the dopamine receptors. Now what happens? Antipsychotics blocks the dopamine receptors while you're what do we say? While you're cocaine actually increases the dopamine levels in synaptic cleft by inhibiting the reuptake. We studied it earlier. Now what does this line mean? Um, the thing is, antipsychotics actually, let's say in cocaine poisoning, the brain is already overstimulated. It is very excited because the dopamine is increased in the synaptic cleft. Dopamine is not only the reason why brain is overstimulated, but generally as a whole, just remember ki cocaine causes overstimulation of brain. It causes overexcitability of brain. Neurons are already firing in cocaine poisoning. What antipsychotics do, they add up in the firing of neuron. They just make neurons free, and because of which neurons start continuously firing, and this leads to addition in seizures. If your brain is already overstimulated, seizures are going to arise, no doubt. So antipsychotics actually add up in occurring causing seizures in brain. So why we avoid antipsychotics? I hope you understood. Decreased seizure threshold means if in a cocaine poisoning patient seizure is going to occur after 2 hours, let's say for example, completely imaginary condition, if I prescribe antipsychotics to that patient, then the seizure would occur in half hour only. That is decreasing the seizure threshold. And in chest pain, you give calcium channel blockers and nitrates. Just try to remember management: sedate plus cool plus dilate vessel. What do I mean by this? Sedate, give benzodiazepines. Cool for hypothermia, cooling for hypothermia, and dilate vessels, calcium channel blockers and nitrates. Remember to avoid pure beta blockers. Fine. This was about the management, very important point. Now what are the autopsy findings? Pulmonary edema, MI, nasal septal ulceration, perforation, multiple injection scars, signs of asphyxia. Now what is the mechanism of action? Drug of abuse, NDPS Act offense, Narcotic Act offense, sudden and accidental death, which is very common, and associated violent behavior. So these are the mechanism of action in autopsy findings, and we also saw some learned about autopsy findings. Pulmonary edema, you will see, MI, nasal septal ulceration, signs of asphyxia. So mechanism of action means how the death occurred, either by drug of abuse, NDPS Act offense, sudden and accidental death, associated violent behavior. Yes. Talking about very interesting terms, body packer syndrome and body stuffer syndrome. So, what is body packer syndrome? It involves swallowing balloons or condoms filled with cocaine, risking intestinal obstruction and potential rupture leading to sudden death. I think you all got this. That it involves the swallowing of balloons filled with cocaine, and if the balloon bursts, then obviously the person is going to die. So that is nothing but body packer syndrome. Generally, it is done by smugglers at the airport checking or whatever. And the second one is body stuffer syndrome. In this syndrome, the person who smuggled the cocaine on the verge of being arrested for possessing cocaine swallows the drug to conceal the evidence. This act causes cocaine poisoning. In first body packer syndrome, the smuggler already packs cocaine in his body. But in body stuffer syndrome, to protect himself from the arrest, the person tries to swallow the cocaine entirely, which causes body stuffer syndrome. He or she just stuffs the body with cocaine packs. That is nothing but body stuffer syndrome and body packer syndrome. So this was all about cocaine. What did we learn? Cocaine introduction: source leaves of Erythroxylum coca, street name coke, crack, snow, vivilite, lay. Forms: two forms, cocaine hydrochloride and freebase. Roots: you all know what are the roots. Preparation: chewing of leaves and coca paste, HCl, cocaine hydrochloride, baking soda, crack, heroin, morphine, speedball plus fentanyl, super speedball, and with solvent it gives freebase. We learned about the mechanism of action. It blocks the dopamine reuptake, thus increasing neurotransmitters in the synaptic cleft. Causes euphoria for a very minimum time, then it is followed by depression. Clinical features: CNS, CVS effects, hallucinations, and severe effects of agitation and seizures. Remember not to prescribe antipsychotics as these decrease the seizure threshold. Remember, sedate, cool, and dilate vessels. So this was all about cocaine poisoning. Now we are good to go, and we'll be solving MCQs. MCQ number 1. I just want you people to stop the video, as I say in every video, to just stop the screen, stop the video, and solve these MCQs on your own. Cocaine exerts its primary action by blocking reuptake, stimulating GABA receptors, inhibiting MAO, blocking NMDA receptors. Answer is option A. The most common route of abuse of cocaine is oral, intravenous, intranasal, or inhalational. So the correct answer is intranasal, which is snorting. Which of the following is not a feature of acute cocaine toxicity? Tachycardia, hypertension, bradycardia, mydriasis. It is bradycardia, option C. The most common CVS complication of acute cocaine poisoning is aortic dissection, MI, pericardial tamponade, or constructive pericarditis. Answer is aortic dissection. It is a factual question. Remember this. Cocaine-induced chest pain is most commonly due to coronary vasospasm, atherosclerotic plaque rupture, demand ischemia, pulmonary embolism. Again, a factual question. But you can guess it because we all know cocaine causes vasoconstriction. So the answer is coronary vasospasm. Which of the following EKG changes is most commonly seen with acute cocaine intoxication? That should be ECG, I guess. Again, a factual question. Answer is ST depression. Cocaine can cause which of the following arrhythmias? Sinus tachycardia, ventricular tachycardia, atrial fibrillation, all of the above. Again, a factual question. All of the above is the right answer. It causes sinus tachycardia also, ventricular also, atrial fibrillation also. Hypertensive emergency in cocaine poisoning is best managed initially with what? Beta blockers, propranolol, nitroglycerin, phentolamine, or verapamil. This is a good question. You just have to remember that propranolol is pure beta blocker. Option A would not come. Correct answer is option C, phentolamine. Phentolamine is competitive alpha adrenergic receptor antagonist. So it acts directly at vascular level to physically unseat and block the excess catecholamines that cocaine has caused to accumulate. So why phentolamine will be responsible for decrease in vasoconstriction. Moving to next, a young man presents after a cocaine binge with severe retrosternal pain radiating to back with unequal BP in both arms. Most likely diagnosis is Again a factual question, it is aortic dissection. Cocaine is a potent local anesthetic due to its action on which channels? Important question. On sodium channels. Option A. Question 11. Which of the following is a CNS effect of cocaine? Euphoria, seizures, hallucination, all of the above. All of the above. Cocaine-induced seizures are best treated with what? Phenytoin, diazepam, phenobarbital, haloperidol. So the answer is option B, diazepam. The crash phase of cocaine use is characterized by hypertension and tachycardia, depression and fatigue, euphoria and hyperactivity, agitation and hallucinations. Crash phase. You can guess it. Answer is depression and fatigue. Which of the following is a common pulmonary complication of cocaine poisoning? Pulmonary edema, pneumothorax, ARDS, all of the above. Common pulmonary complication. All of the above. Pulmonary edema also, pneumothorax also, ARDS also. Cocaine-induced pulmonary edema is most likely due to increased capillary permeability, left ventricular failure, direct toxicity to alveoli, all of the above. All of the above. Which of the following is an imaging finding suggestive of cocaine-induced pulmonary edema? Curly B lines, bilateral diffuse alveolar infiltration, hyperinflated lungs, pleural effusion. So you can see the, just observe the X-ray by zooming it. You'll be able to, see the whitish or say something. It is not black near the alveoli. So the answer is option B, infiltrates, alveolar infiltrates. You see the whitish plague-like, not plague, it's kind of opaque thing because of the infiltrates, or else it would have been completely black. Cocaine can cause which of the following neurological complications? Ischemic stroke, intracerebral hemorrhage, subarachnoid hemorrhage, all of the above. Answer is all of the above. The mechanism of cocaine-induced ischemic stroke is most commonly vasospasm, vasculitis, cardioembolism, hypotension. Vasospasm. Cocaine can cause mydriasis due to stimulation of which activity? Sympathetic, parasympathetic, dopaminergic, serotonergic. Sympathetic activity, because it stimulates the brain, so sympathetic activity. Which test is most useful to detect cocaine use in ED setting? Again a factual question. Answer is urine toxicology screen. ED is emergency, okay? Emergency department. Going to next question. A known cocaine abuser presents with sudden severe headache and vomiting. CT brain is shown below. Most likely diagnosis is. Again, not a factual question, but yes, conceptual question. So the answer is intracerebral hemorrhage, option B. You can observe now I'm not able to zoom this, but just pause the video and zoom the X-ray. You'll be seeing intracerebral hemorrhage. There is opaque whitish occurrence in center. So that is nothing but intracerebral hemorrhage. Cocaine is associated with which of the following ENT complications? Septal perforation, epistaxis, chronic sinusitis, all of the above. All of the above. Factual question. Which of the following is true about cocaine-induced rhabdomyolysis? Due to vasoconstriction and hypothermia, presence with dark urine and raised CK, can cause acute kidney injury, all of the above. Rhabdomyolysis is breakdown of muscles. All of the above is the right answer. Dark brown urine in cocaine user is most likely due to hematuria, myoglobinuria, bilirubinuria, porphyria. I told you now only rhabdomyolysis, which means myoglobinuria. Option B. Which antidote is used in life-threatening cocaine toxicity? Severe hypertension, not responding to benzodiazepines. Again, phentolamine, because it is competitive alpha adrenergic receptor antagonists. Which of the following statement is true regarding beta blockers in cocaine poisoning? They are first line, they can cause unopposed alpha stimulation, they are completely contraindicated, they are safe if given with nitrates. Option B is the right answer. A patient with cocaine overdose develops agitation and severe hypertension. First line management is, we all know this. It is diazepam, benzodiazepines. Which of the following is a long-term complication of chronic cocaine use? Dilated cardiomyopathy, chronic kidney disease, Parkinsonism, all of the above. All of the above. Cocaine can cause coronary vasospasm, coronary angiogram may show normal coronaries, diffuse narrowing vasospasm, thrombotic occlusion, aneurysmal dilation. It is quite easy. It is diffuse narrowing, which is vasoconstriction, vasospasm. Management of cocaine poisoning is primarily decontamination, supportive and symptomatic, specific antidote based, forced diuresis. It is supportive and symptomatic. So, yes, we have solved MCQs on cocaine poisoning. If you want, you can take screenshot of the notes as well. Just try to revise cocaine poisoning. It is very short topic but important topic. Every topic is important, and just keep revising, go through it once, and yeah, we are good to go then. We completed cocaine poisoning. Next would be on strychnine poisoning, next video. And yeah, so stay tuned for upcoming videos also, and don't forget to subscribe and hit that bell icon. Yeah, we are good to go. We have completed the cocaine poisoning. And yes, keep learning, keep revising. Bye. See you in the next video.